Hello and welcome. This is Christine from Global Collaborations with immense pleasure. Let me walk you through the detailed project presentation of Premier Hospitals, an upcoming super specialty hospital in the capital city of Gujarat State in India, one of its kind in the region. And with me, I have Cam Patel, the Marketing Director of Premier Hospitals for USA and Canadian markets, while in India, the marketing is taken care by Nitin Shah.
Hi, this is Cam. Welcome. As you see here, this facility will have super specialty joint replacement, cosmetic surgery, cardiology, neurology, gastroenterology, dental facilities, gynecology, infertility treatment, and all the best that we can offer. Let's go to the next slide.
Premier Hospitals is a brainchild of a group of medical professionals with years of successful practice and expertise in their respective field of medicine. The project is located in the heart of the capital city, Gandhinagar in Gujarat State, which has been recognized the fastest growing state of India and, from the investment point of view, one of the safest destinations with maximum productivity and the least labor problems, and headed by one of the most dynamic chief ministers of all times in the state.
For more details about the progress of Gujarat State, you may visit www.gujaratindia.com and just click on Infrastructure. Then click on Policies, and you may also click on Investment Opportunities. And you will realize why Premier Hospitals have certainly made the right decision to be in Gujarat, from the standpoint of service to mankind, investments, funding, and profitability. Premier Hospitals is putting up 150 beds with 50 plus critical beds and host of other facilities, which makes it one of its own kind and guaranteed to be the best in the state of 60 million people.
Vision and mission. With the dedicated services and the best quality services to establish a brand in healthcare industry by providing world-class medical treatment, research and training, and knowledge imparting institutions. Mission and targets. Premier Hospital has set up its mission. A. To have world-class no-pain resolution to patient sickness and ailments and work with the patients for having lifelong preventive mechanisms. B. To follow up every treatment with preventive measures for the patient's family and friends. C. To complement primary and secondary care with tertiary care. D. In the first 2 years, to be recognized as the best hospital in the state. E. Have satellite treatment centers in every district of the state to reach the rural and poor families. F. Provide international class services for overseas patients and make their medical tourism a main forte and revenue source. G. Replicate the success in nearby 10 districts and 4 states and establish a brand name.
Dedication of dedicated medical professionals becomes Premier Hospital. This slide is in fact what the hospital will be, just the front end. The activities behind this building, in this building, and all through will be something of a global class. This is Premier Hospitals.
The people, the promoters. Let's look at the next slide. Let's take a look at our major promoters. First, we have the CEO, Dr. Rajesh Chaudhary, a urologist and a kidney transplant surgeon practicing since the past 5 years. His vast experiences include endourology. After that, we have Dr. Paresh Shah, a physician and a dialectologist. Next, Dr. Priyan Shah, a general and laparoscopic surgeon. After that, we have Kaushik Gajar, a general and laparoscopic surgeon practicing since the past 20 years. After that, we have Mrs. Sneh Prabha Chaudhary, speech and language pathologist. Next, we have Dr. Anish Chandarana, interventional cardiologist. After that, we have Dr. Bhadresh Shah, intensive and critical care specialist. After that, we have Dr. Bijo Parikh, cosmetic surgeon. Next, we have Dr. Manish Bhatnagar, gastroenterologist. Next, we have Dr. Mukesh Shah, orthopedic and joint replacement surgeon. Next, we have Dr. Anand Kakahar, chief liver transplant surgeon. And last but not least, we have Dr. Atit Sharma, orthopedic and trauma care specialist. Let's take a look at the advantage of our location.
The project location advantage. Premier hospitals located at Gandhinagar city, the capital of Gujarat, one of the most progressive states of India. Is pretty well connected with international airport, rail and road links. Mega projects around the hospital location are DLF Information Technology Park, Tata Consultancy Services offices, Reliance InfoCity, National Institute of Design, NIFT, ICICI Bank, and proposed Gujarat International Finance City. All of them just are around the vicinity. There is no exclusive Taruma Care facility, tertiary care, hospital facility availability in and around the Gandhinagar area. That's one of the major locational advantages we have. Gandhinagar is surrounded with multiple progressive villages with no such facilities available and that makes this project an ideal location. Gandhinagar is a populated area and having 2 million population without a good hospital, while it's the capital of the most progressive state of Gujarat. Possibility of increase in population is the highest in the area around InfoCity, as more than 100,000 families are expected to flow in this upcoming decade. IT Special Economic Zone designated by the state of the government of Gujarat makes it more advantageous location for premier hospitals. This slide gives us an idea of the location advantage that we have. The areas from where the patient drainage would be there, the areas around the InfoCity super specialty hospital bed, and how the proposed population at decadal growth would be there. This slide further gives us detailed idea of the projected corporate clientele that Premier Hospitals is going to have. As we see in this chart here, there are 50,000 employees of the government of Gujarat in the vicinity of the hospital. Then we have 8,000 employees from Tata Consultancy Services. ICICI Bank Group has around 10,000 employees. DLF IT Park around 8,000 employees. Centel around 5,000 employees. NID around 2,000. NIFT 2,000. GSPC around 2,000. And the InfoCity itself has around 2,000 people, which really makes us having a wonderful advantage of so many employees from different organizations, ultimately making for premier hospitals a wonderful locational advantage in terms of the availability of patients to serve.
This slide shows the surgical specialties that premier hospitals will offer: accident and emergency cases, cardiothoracic surgery, cosmetic and plastic surgery, gastrointestinal surgery, gynecology and obstetrics, high-risk pregnancy, laparoscopic surgery, neurosurgery, oncosurgery, orthopedic surgery, joint replacement, spine and trauma, pediatric surgery, renal transplant, vascular surgery, and urology. The project detail. Project location is in Gandhinagar. The hospital space has already been reserved. In total, there are 2 phases which will take 18 months to complete. The first phase is to add 150 beds, out of which 25 of them will be critical care beds. second phase include 50 beds at a cardiology and critical care center. Next is adding 4 operation theaters and a cath lab. We're also going to include a helipad for airlifting trauma patients. There will also be CT and MRI facilities available. 20 mobile medical vans will be there for providing healthcare facilities in rural areas. A telemedicine network for 24 hours connectivity with peripheral centers. Construction of 5 satellite centers for drainage of the patients. And last, a health card membership scheme to be distributed among local and corporates.
This slide shows the project detailed specialities. We already discussed about surgical specialities in earlier slides. Let's talk about medical specialities that would be there. Anesthesia, cardiology, critical care and pulmonology, ENT, gastroenterology, hemato-oncology, infectious diseases, neonatology, nephrology and dialysis, neurology, pediatrics, rheumatology, and skin disease. This would be under the medical specialities. There are other specialities
which are dietetics, occupational therapy, ophthalmology, pathology, physiotherapy, radiology, special clinics, menopause clinics, well baby clinics, pain clinics, sleep lab, obesity management clinic, arrhythmia management clinic.
As we go and look at the further detail of the project, let us give you an idea about the service facility and the capacity of bed each would have. ICCU would have 15 beds, Neuro ICU would have 10 beds, Medical ICU 15 beds, Surgical ICU 10 beds, and ICU will have 10 beds. Economy rooms, there would be 30 beds. Twin sharing rooms, there would be 10 beds. Special rooms, there would be 15 beds. Super deluxe rooms, there would be 15 beds. Casualty, there would be 15 beds. Dialysis, there would be 10 beds. And if we look at the floor-wise services, in the phase 1, the basement is going to be covering up laundry, morgue, storeroom, timekeeping, labor room, and labor office as well. In the ground floor, we are going to have radiology, 6 casualty wards, reception, billing, and pharmacy. On the first floor, OPD, diagnostic, executive health checkup, CT and MRI. In the second floor, we'll have administrative office, cafeteria, dining, ENT, ophthalmology, blood bank, pathology, ICCU, NICU, and all those beds that I just mentioned before a while. On the third floor, we will have the wonderful and the most modern cath lab and cardiac operation theater. This slide is the diagrammatic representation of the telenetworking of the satellite healthcare centers and the mobile health clinic at villages that we would be having. This slide shows the images of pathological lab and the radiology center.
The following example images show the premium suite on the left, the special room in the center, and the normal suite on the right-hand side. Since we are going to offer care to patients worldwide, we are going to have a state-of-the-art website, an online booking, online medical guidance, web seminars, and video conference facilities. International tie-ups. Premier Hospitals has geared itself to have partner hospital relationships with hospitals for any critical consultations and mutual updated guidance to keep itself updated about any latest developments. In America, discussions are underway in New Jersey, New York, Alabama, and Miami. In England, discussions are underway in London and Birmingham. The Medical Tourism Project. What is medical tourism? It is when patients go to different countries for either urgent or selective medical procedures. It has become a worldwide, multi-billion-dollar industry. Why India? In India, it is estimated that medical tourism could bring anywhere between $1 to $2 billion into the country by 2012. The reports estimate that medical tourism in India is growing at 30% a year. The advantages: world-class medical facilities in major parts of India, a cost difference in treatment as low as 1/4 or sometimes even 1/10 of the cost of the same treatment compared to in America. There is no waiting for treatments, and you receive personalized services with tax benefits in America. One can also combine it to be a leisure tour or learn yoga or undergo Ayurvedic treatments along with the main treatment. There's also excellent low-cost travel facilities. The medical tourism marketing setup. Marketing tie-ups and approval placement processes are underway with 5 healthcare insurance companies in America. Exploration is underway to get a hospital approved in England. Marketing offices are being set up in Nepal, Sri Lanka, and Dubai to facilitate Asian customers, while confirmation of partnership offices have already been received in New Jersey, New York, Pennsylvania, Alabama, and in the UK and South Africa and Fiji. Future projects that are expected to be complete by January 2011. Medical Institute and Research Center. Setting up a medical college, one that will facilitate education for medical school students, a paramedical training center, clinical research center for various clinical trials, and setting up of research units in affiliation with overseas research institutes. For more information, please contact Premier Hospitals Private Limited at 156 Supermall 2, Info City, Gandhinagar, Gujarat, India, or visit them at www.premierhospitals.in. You may also contact Dr. Rajesh Chaudhary, the CEO, Mr. Nitin Shah, the Director, Mr. Kam Patel, the Marketing Director for USA.